Thank you. Good morning, Miriam. My name is Samantha, and I'm the nurse that will be looking after you today. How are you going? It's good. I'm just going to read your patient notes, if you just give me a quick moment. Thank you. Okay. Miriam, I can see that you've fractured your ribs and we're due to give you some morphine for the pain today. Before I start any of that, I'm just going to get you to tell me your full name and your date of birth so I can just confirm I've got the right patient. So while I do that, I'm just going to check your armband at the same time. So if you can tell me your full name.
Miriam Adib.
Miriam Adib, yep. And your birthday, please?
7th of January 1969.
Great. Just check your MRN number is 174963. 174963.
Yep.
Perfect. And Miriam, do you have any allergies?
No.
Okay, so Miriam, I'm going to ask you to rate your pain. So 1 being no pain at all and 10 being quite severe. So 1 to 10, what would you rate your pain today?
An 8.
Okay, and is it just in your ribs or does it radiate to any other parts of your body?
It's in my ribs.
And how long has this pain been occurring for?
Since my car accident earlier today.
Okay. I'm also just going to check your cannula site just to make sure it's clean and free from infection and swelling. So does it hurt around the area?
No.
And when was it placed in, Miriam?
This morning.
Okay, lovely. That's within the correct time frame. Okay, so I'm just going to do some checks with my nurse and gather some equipment. So I'll be back in just a short moment.
Yep.
Normally at this point in time, I would do a full set of obs on the patient. But I won't be doing that today in the assessment, so I will just go right ahead into checking that I've got a valid medication order with my second RN. So today I have a medication order. It is for Miriam Adib. I've confirmed her name, date of birth, her MRN number. She also has known allergies. We're going to be giving her 50 milligrams of morphine in 50 mils. That's for her fractured rib pain. The order has been signed by a doctor. The order has been correctly filled out with the concentration, dose, lockout intervals. It's to be given intravenously. It's not being given yet today. We do have an antiemetic and for any GI upsets, and we have Naxolon in case of too much dosage being administered. So now what I'm going to do is I'm going to check MIMS and the injectables book to make sure that I have everything correct for this patient. Okay, so MIMS, I've got morphine and it's used as a pain reliever. Some adverse reactions are respiratory depression, GI upset. There may be some dizziness or some urinary retention. We shouldn't be using this medication if there are any airway obstruction diseases or respiratory insufficiencies. I'll be checking the dose for a PCA is 0.5 to 1.5 mgs for an adult, and that falls, our dosage recommended today falls within the therapeutic range. So I'm confident that we're on the right track. So I need to dilute my morphine with normal saline. So I'm just going to check the injectables book to make sure that the normal saline is a compatible fluid. And yep, sodium chloride is a compatible fluid, so that is wonderful. I'm now just going to collect my equipment. And I'm going to make my way to the SA drug cupboard to withdraw my medication. Okay, so I've just come to the SA cupboard to withdraw my medication, but before I do so, I'm going to have to do a few quick calculations just so I know how many vials to withdraw from the cupboard. So in total today, I need to administer 50 milligrams of morphine, and each ampule has 10 milligrams in 2 mils. So that means in total I need to have 10 ml of fluid containing the morphine. So how many vials do I need? I need 10 ml in total. Each vial contains 2 ml, so I'm going to need 5 vials altogether. In total, I need to have 50 ml of fluid. So I already have 10 ml from the morphine, so I'm going to do 50 ml minus 10 ml, which leaves me with 40 ml of normal saline. So 5 vials, 40 ml of normal saline. Altogether, it's going to equal 50 ml, which is what the order requires. So with my second RN, what I'm now going to do is go to the SA cupboard and withdraw and check all the medication. So second RN, if you don't mind. Okay, so I need morphine, 10 milligrams in 2 mils. Morphine, 10 milligrams, page 1. Okay. So I've got 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, which is the balance from last time, so that's good. Morphine sulfate, 10 milligrams, 2 ml, expiry 2019. Morphine sulfate, 10 milligrams, 2 ml, expires 2019. Morphine sulfate, 10 milligrams, 2 ml, expires 2019. Morphine sulfate, 10 milligrams in 2 ml, expires 2019. Morphine sulfate, 10 milligrams, 2 ml, expires 2019. Morphine sulfate, 10 milligrams, 2 ml, expires 2019. Morphine sulfate, 10 milligrams in 2 ml, expires 2019. Morphine sulfate, 10 milligrams in 2 ml, expires 2019. Morphine sulfate, 10 milligrams, 2 ml, expires 2019. Morphine sulfate, 10 milligrams in 2 ml, expires 2019. Morphine sulfate, 10 milligrams, 2 ml, 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 expires 2019. So I'm confident that I have all the right medication and that it's within date. The balance is 15. I need to take 5 away today. 1, 2, 3, 4, 5. As per my drug calculations earlier. So we're going to be left with 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I'm just going to fill out the S8 book. And if my second RN could just confirm that I've got 10, and if she can sign the drug, please. I'll just give you a close-up like that. In the real world, I wouldn't leave the key there. I would take it and give it back to the person who's in charge of the keys, but for today, that's what we are instructed to do. Second RN, if we could do my first drug check today. Yep. So I've already confirmed with my first patient check that I've got Miriam Adib. I've confirmed her MRN number, her date of birth. She has no known allergies, so I have the right patient. I'm going to be administering 50 milligrams of morphine. So my drug calculations have shown me that I need to administer 5 vials and 10 ml of fluid. So I've got morphine sulfate, 10 milligrams in 2 ml, expires 2019. Morphine sulfate, 10 milligrams 2 ml, expires 2019. Morphine sulfate, 10 milligrams 2 ml, expires 2019. Morphine sulfate, 10 milligrams in 2 ml, expires 2019. Morphine sulfate, 10 milligrams in 2 ml, expires 2019. So we've got the right drug. I need to mix that with 40 ml of sodium chloride to make 50 ml of fluid altogether. So each vial is 10 ml. I need to have 40 mils of sodium chloride, so I've got 4 vials. So you can see sodium chloride 0.9% in 10 mils, expires Feb 2018. Sodium chloride 0.9% in 10 mils, expires Feb 2018. Sodium chloride 0.9% in 10 mils, expires Feb 2018. Sodium chloride 0.9% in 10 mils, expires Feb 2018. So I've got the right patient, the right drug, I've got the right dose, I've got the right route, it's IV, and I have got the right time because it is junior and it has not been given. So we have just checked our drugs for the first time. Okay, I'm now going to draw up my medication. I'm going to draw up the 40 mils of sodium chloride first. If you'd like to check my second arrow, please. I've got 40 mils of the normal saline that I've just drawn up.
Yep.
I'm now going to draw up the 5 vials, which will equate to 10 mils, meaning I've got 50 mils in my syringe. Okay, in the real world, I would remove my sharp, place it in the sharps bin, and then I would recap my syringe with a capped needle to prevent any contamination. I don't have that option today, so I'm just going to remove my needle and I'm going to lay the syringe just neatly here, but as I said, in the real world it would be capped. So I am just going to fill out my additive label. My patient, Mary additive. As my second RNA, would you please check that? Yep. Good. Okay, so I've drawn up my medication. I'm going to get my second RN to do my second drug check with me. So second RN, if you will. I have got Miriam Adib. I've confirmed her MRN, her date of birth, and she has no known allergies. So I've got the right patient. Today I'm going to be administering morphine, 50 milligrams in 50 mils. So I have got 5 vials to check. So we've got morphine sulfate, 10 milligrams in 2 mils, expires 2019. Morphine sulfate, 10 milligrams in 2 mils, expires 2019. Morphine sulfate, 10 milligrams in 2 mils, expires 2019. Morphine sulfate, 10 milligrams in 2 mils, expires 2019. Morphine sulfate, 10 milligrams in 2 mils, expires 2019. I've also got 4 vials, which is 40 mils of fluid of sodium chloride. So I've got sodium chloride 0.9%, in 10 mils, expires February 2018. Sodium chloride 0.9% in 10 mils, expires Feb 2018. Sodium chloride 0.9% in 10 mils, expires February 2018. And sodium chloride 0.9% in 10 mils, expires February 2018. Altogether, I've got 40 mils of sodium chloride and then 10 mils of morphine sulfate. So in total, that's going to equal 50 mils, as you can see here in my prepared syringe. So we've confirmed we've got the right patient, the right drug, the right dose, the right route. It's going to be administered intravenously, and it has not been given, and it's due now. So it's my second drug check. I am now just going to connect my line to the syringe and place it in the PCA machine. Very tangled. Lovely. I now have a primed line. And I'm just going to pop it into the PCA machine. So I've popped my syringe with the prime line in the PCA machine. I'm now going to get my second RN while I set this machine up to check over the details with me. Okay, so I have a new patient. Yes, I do. Confirm new patient. Yes. Okay, so drug name, morphine. That's great. Drug concentration. We have got 1 milligram per mil, 1 milligram per mil, that's wonderful. Our PCA dose today is 1 milligram, PCA dose 1 milligram, that's great. Lockout period, we have a lockout interval of 5 minutes. Lockout period 5 minutes, that is also correct. Okay, we do not have a continuous dosage today. Our maximum limit is 12 milligrams per hour, so I'm just going to change that to 12 mgs per hour. Okay, 12 milligrams per hour. Per hour, my delivery is stat. So I am confident that the details I've added into this machine match the details on my order. Okay. So what I am going to do next will be my second patient check and then my third and final drug check. Okay. Hi Miriam. I'm back here. We're about to hook you up to the pain medication for your fractured ribs. Before we continue, can I just get you to tell me your full name and your date of birth again, please?
Miriam Adib, and my date of birth is 7th of January 69.
Perfect. I'm just going to check your MRN number on your wrist. We have 174963. 174963. And Miriam, do you have any allergies?
No.
Okay, now I'm going to be doing my third and final drug check with my second RN. So my second RN, if you'll join me, we've just confirmed that we have our patient Miriam Adib. I've confirmed her MRN and her date of birth. She has no known allergies, so we have the right patient. The drug that is ordered for today is morphine, 50 milligrams in 50 mils. So I can show you that I've got morphine sulfate, 10 milligrams in 2 mils, expiry 2019, morphine sulfate, 10 milligrams in 2 mils, expiry 2019, morphine sulfate, 10 milligrams in 2 mils, expiry 2019, morphine sulfate, 10 milligrams 2 mils, expires 2019, morphine sulfate, 10 milligrams 2 mils, expires 2019. So they're my 5 vials that make up 10 ml of fluid. I then needed to add 40 mils of sodium chloride. So we've got 4 vials. Sodium chloride, 0.9%, 10 milligrams in, I'll start again. Sodium chloride, 0.9% in 10 ml, expires Feb 2018. Sodium chloride, 0.9%, 10 in 10 ml, expires 2018. Sodium chloride, 0.9% in 10 ml, expires 2018. Sodium chloride, 0.9% in 10 ml, expires 2018. So altogether my fluid is equaling 50 ml of fluid, which we can then see in the syringe, 50 mils of fluid. So we've confirmed our patient, right drug, right dose. The route is IV. It's going to be administered through the IV PCA. And the right time, it's due to be given now, and it has not been given as yet. Thank you. Now I am just going to wash my hands, pop on some gloves, and connect the line to my patient. Just going to clean your cannula site in your own before we attach all this together. We're all connected. So Miriam, I'll just explain how this is going to work. So we're giving you morphine today for your pain from your fractured ribs. And what's going to happen is I'm going to give you this little buzzer. Now, every time you press the green button, it's going to administer a small dose of morphine to help with your pain. You can only press the buzzer once every 5 minutes. So I'm going to pop that at your bedside here. I'm also going to come back in 15 minutes to check on you. If you need anything within that 15 minutes, I've got your nurse's call buzzer just down by your other hand as well. Do you have any questions at the moment?
No.
No? Okay. I will just pop the machine on so you can start when needed. So you're all set up now, Miriam, like I explained to you. If you feel the need to administer yourself some of the pain medication, you just pop the green buzzer. It will only allow you to administer that to yourself once every 5 minutes. Nurse call buzzer is on your left-hand side if you need me for anything, but I will be back in 15 minutes. So I've concluded my interaction with the patient. Just going to wash my hands, dispose of my and I am just going to fill out the chart. So today is the 23rd of the 3rd, the time is 10:35 and I have signed that off. Nurse, as my second RN, if you're able to please just check that's correct and sign off for me.
Mm-hmm.
And I'm
Oh, sorry.